Well, good afternoon, everyone. This is Dr. Jacqueline King, and I am back. I was here yesterday, I think. Yesterday, yes, with Bianca. And now I have another amazing woman, Dr. BCW, as she calls herself, the amazing doctor. She is so multi talented. We are honored to have her on today. She is a TED Talk speaker, and she has so much that she does. Nonprofit. You have a nonprofit, right?
I do. I'm associated with two nonprofits, so not my own
Okay.
personal, but associated with some.
Okay, and she goes around and talks about women's health, and this is Breast Cancer Awareness Month, and she has on her pink. I have on the Steelers. I'm a Steelers fan, but anyway, everyone, thanks for joining in. Share the broadcast. This is a very important topic because Black women are the fastest dying women, I believe, due to breast cancer. Is that right, Dr. Bayo?
That is correct. I'm so glad that we're highlighting this issue and really delving into the many pieces that are part of this statistic that we continue to hear about and see.
All right, just give them a little couple of snippets. Hello, Carla, and share the broadcast, please, ladies, men. Share the broadcast because this is something that everyone needs to hear. So, just a little snippet. Now, I know you know. I don't like talking about myself either.
I
I get it. But just give us a little bit.
Yes, I will. Right before the show, so everyone can know. She was like, just share a little bit about you, and I'm terrible at that, and I've got to work on that. So, but thank you just for having me first and foremost. So, I'm Dr. Bayo Curry-Winchell, but I go by Dr. BCW, which also stands for Beyond Clinical Walls. So, who would have thought that my last name
Wow.
would represent what I love to do, which is deliver care in a non traditional format and help as many people as I possibly can. So, I'm a family medicine physician. I practice urgent care, and as well as I'm the medical director of the sexual assault response team. I have a health series podcast that delivers health information in a digestible, engaging, and informative manner in hopes that I highlight health equity, but also provide you with just basic symptoms and solutions. That's a big piece for me of what you can do about a wide variety of topics. So you can find it on all social media platforms. I also have the privilege of being a practicing physician. And so I see patients and also contribute to national television and publications. So with all of that, the pieces that really make up who I am, I have to highlight my father. And so Dr. King and I were talking about when we talk about why I do what I do, I always like to highlight my father, William Curry, who is a 99-year-old triple war veteran, World War II, Korean and Vietnam. And I share his story because we all have a why of why we do things and why things are important to us. And he really set that foundation for me. I grew up going to rallies, different things, advocating for things I didn't know, but I knew I was standing up for something big. And that has been my through line with all of the work that I do. And so I always like to highlight that and just share my reason why for giving back in any way that I can. So thank you, Dr. King, for having me. I am so excited to be here.
Well, we have so much to cover. Hello, Priscilla, and everyone that's joining. Please share the broadcast. Again, I asked you to please share the broadcast because that's how we make it go viral. So, Dr. BCW, so tell me, let's talk about breast cancer and the statistics.
Yes. And so when we talk about breast cancer, we know that there is a rate, a statistic that 40% of Black women are diagnosed with breast cancer. Although the number of cases are lower for us comparatively to white women, we are diagnosed at the highest rate. We are dying at the highest rate. And so when you look at those factors, it's important to think about why is this happening? And so I like to start off with some definitions because I think that helps uncouple some of the statistics that we see. And so we often hear Black women, and I like to talk about when you are Black, the color of your skin is a social construct. It's not biological. And so when we see these statistics kind of coupling that, we have to look at why is it that this group, based on the color of their skin, are dying at a higher rate. And color of your skin is different than ethnicity. And so there are many factors that we'll get into of why this is happening, but it's important that we advocate for screening, for awareness, to know the symptoms that we may not hear about based on multiple factors, such as unconscious bias, access, all the other things that contribute to the rate of diseases impacting our community.
Yeah. So, is the reason that we're dying is it because of lack of resources, poverty? What is like the main reason that most Black women are dying? They don't get the mammograms. What is it?
I think it really is multifaceted. So the offering of knowing that you should get screened is huge. And so when we look at the number of offerings that are happening, it can't be enough, or it's not what it should be, because we would have more rates of screening and we would be able to know about if we have breast cancer. So I think the
Mm-hmm.
offering, the information as well, the health literacy piece of highlighting that we are at a higher rate because of these multiple factors, and also knowing just the signs and symptoms. And I think all of those pieces, because when you look at breast cancer, when you look at colon cancer, when you look at Black women dying at the highest rate during childbirth or shortly thereafter, there is a through line that is consistent with the color of our skin and the rate of disease or death. So there's all of these things that we have to look at, that it's beyond just access. Because I think, Dr. King, we often hear it's a social economic problem. It's a access problem. And
Mm-hmm.
that's where we have to kind of look at, no, it can happen in all areas. And that's why I'm excited to kind of delve into this even more.
Yeah, so I know that someone told me, and I won't even say who it was because there's somebody that's pretty well known, that we should not be getting mammograms because mammograms actually cause cancer.
So, my response to that would be to look at what mammograms, like what is a mammogram? Look at the opportunity to know what is inside your breast, because I hear sometimes from people, whether it's breast cancer or any disease, I know my body best. And I don't discount that. I think we all know ourselves well because we are a part of it every day. But there are diseases and things that you you have no idea, because a lot of them are silent diseases. And so a mammogram provides the opportunity to know what is happening internally so you can respond to it. And so I think we have to look at, through the history, the amazing tools and diagnostic opportunities that we have to be able to live longer, or know about specific diseases so we can respond, is vital. So I would encourage anyone who is concerned about that, look at the history of mammograms, look what they can do, but then it is an individual decision, and I will always support that. And if it's something that you feel doesn't out it the risks outweigh the benefit, then that is your health journey. But we have to be thoughtful in the fact that this screening can save lives. And as you know, I decided to kind of showcase what a mammogram is, what's the process, just in hopes of just kind of lifting that curtain and helping people.
Well, that was great that you did that. And so I mean, I remember I've been getting them for a really long time now, but I remember the first one, and so it's a challenge. I mean, it's not comfortable, and I can't imagine if you have small breasts, which I am not in that number. I I can't imagine what it's like trying to squeeze up in between those plates. You know what I'm saying?
Well, I fit that category. So I can share. So let me. So a couple of years ago, I decided, because I was always raising awareness and just trying to kind of highlight, because for me, just when I talk about being a physician and being able to help people, if I can utilize anything that's part of my personal story or something that people can relate to, I find it really a form of connective tissue for people just to kind of have more information. So I thought, it's time for my first mammogram. I'm going to go ahead and record this. And people were like, "You're going to do what?" And I'm like, "Yeah, I'm going to record it." So you see me checking in, you see the machines, the noise, the sound, the squeeze, and
Please ain't no
just
joke, girl.
yeah, I was like, "Let's go." Like, I didn't want it to be like, "Oh, I come out and, oh, it was wonderful." No, I want you to see it, see what's happening. And so through that, I shared statistics in hopes of, again, moving that needle of health literacy and being informed of the risk factors you should know. And so a couple days later, I received the results, and I actually got a phone call, and they said, "Dr. BCW, we actually found calcifications. And so we're going to need you to do a diagnostic." And at that moment, Dr. King, it was interesting because I've had over 10 years experience as a physician. I've had to share news with my patients and say, you need to get a diagnostic, you need to get further screening. And to experience it myself and feel those emotions of anxiety, fear. Oh gosh, do I even want to know what the results are? It was really, it took me to my core. And so I thought, this is an opportunity, no matter what the results are, to help people. And so I decided to memorialize it and go back and record what that second step process is, just in hopes that if somebody else might be going through this with whatever disease process, maybe that might help provide some sort of encouragement. And so recorded it. You see me get the diagnostic. I share information about that. And then there's a process that people are not aware of, that after you have it done, you're waiting for the radiologist to
Mhm.
look at the results. And that can be daunting because you're just sitting there. No one's telling you anything. And so I
Well,
recorded that.
well, no, actually, with mine, I don't get mine immediately. They mail me the results. Like, I don't get it. They don't tell me anything right away. I've never been
Oh,
anything right
that's
away.
the second process one, they do. At least for me, the second one. The first one, I just got a phone call and they, mailed the results. But the second one, the diagnostic, that's what I experienced. And so I decided to, and the radiologist didn't know this. He has forgiven me at this time, but I go in and he's telling me the results, and he's like, "What's going on here?" And I'm like, he's like, "You want to record this?" I was like, "Yes, I do. Yes, I do."
Oh, wow.
I just wanted to kind of
But
showcase.
what did you do with that recording? Where is it? Is it on
Oh,
YouTube?
it's you can see it on YouTube. Yep.
Oh,
You can
wow.
see it. And
We'll have to
and
share.
yes. And so I got the results. I'm so grateful that they were normal, and I want to highlight that. And so what I decided to do from that was, every year since then, and I'm going to be releasing my one from this year tomorrow, I decided, let's continue this process. Let's continue each year that I get a mammogram, I'm going to record it. And because every year I again have this fear and anxiety, like most of us. Oh gosh, what could the results be? So I'm just grateful to be able to have something that I hope is helping people across the world have more information about this process, what it feels like. And I always say at the end, this uncomfortability that I had with that squeeze um, was investing in my health and the opportunity to do something if I received an abnormal result. So yeah, that's
That
what I
was
did.
very, very brave of you. I put on the screen what Sahara. I don't know if you can see that. What she put on the screen. Can you read that?
No, I was just looking above. I haven't seen. I can go down. Oh, my cancer car. I demanded my first mammogram before 40 due to family, and it was found that day. Yes.
So we thank you, Sahara,
Yes.
sharing that information. Every now and then I'll put up comments so that they know that we are definitely paying attention. And actually, Charisse says, so good removing the veil and bringing awareness. Um,
Yes.
and she is a 6-year breast cancer survivor.
Congratulations.
Thriver. I like that. I like that.
Yes,
Charisse,
Thriver
I like
is
that. Thank you for sharing.
huge.
And Carolyn says, I appreciate you recording to help us understand the process of mammogram. That's really nice.
Thank you,
That's
Carolyn.
really, really nice.
Oh,
We have, I'm telling you what, our followers are loyal to a fault. I love them. I thank God for them. This is being going live right now on 5 Facebook pages, LinkedIn, and YouTube. And we want to give a shout out to iWoman TV. Kathleen
yeah.
Trigg Jones is allowing us to be live on her Facebook page as well. So we give a big shout out to her. That's my little sister. I call her my little sister and my business partner. But we have to continue talking about these things, and making sure that we're doing everything possible. I lost my sister-in-law at the age of 55 to breast cancer.
Oh,
She um they tried everything. She went to the, was it breast cancer centers of the world or whatever. Remember, they couldn't do anything. She was at Duke Hospital. She went everywhere. They could do nothing. She was only 55 when she passed away. My aunt, I believe my aunt passed away at she was about in her 50, about 59. She
oh,
had she had
wow.
13 kids. uh, I think it was 13 or 14 kids she had. But yeah, so we have to keep talking about it. We have to keep reminding our sisters, our queens, that this is
Yes.
your body. You're responsible for your body. And if you don't take care of it, no one else is going to. Right, Doc?
That is so true. We have to keep, there's power in the oral history of being able to advocate and share the stories of people who have unfortunately passed away or been diagnosed. And I think within our community, the more we can share these stories, that is a way of helping or bringing health information to everyone so they know, like, yeah, I should get that mammogram, or this saved, this person's life, or this really made a difference, knowing, just as that story that was talked about, like I demanded my mammogram. And so we have to continue to do that, whether it's breast cancer, during pregnancy, all of these risk factors that we experience. It's important that we, have a collective voice and use that voice to raise awareness for us to be able to have the best healthcare possible.
Absolutely. And Tara, we're glad that you're cancer free. She said you were
Yes.
diagnosed early. And thank you all for sharing. Please share the broadcast. I can't say it enough. We were on yesterday with Bianca, and the thing is that she talked about making sure that you had access to your medical records, which a lot of us don't think about, but with technology now, we have my chart and all kind of stuff. There is no reason not to know what's going on with your body. Now, I personally, and now I have Dr. Bayo too. I have doctors look at my chart. I'm like, here, look at this chart and tell me what this is and what do I need to do. That's what I do because I'm
Yes.
a doctor. I don't know what all this stuff means. You tell me what this means, and I'm blessed to have connections like this that I can send them. That like, look at this for me. But at very least, you need to look at your chart. If you don't have the access, I think everybody's doing online now, right, Dr. Bayo, where you could, right?
Yes, yes. Most places have where you should be able to have the opportunity to look at your chart. And the other thing that I think it's important when we talk about access is, when you're seeing, when you're in the exam room and your clinician is sharing health information with you, and if you don't understand it or you feel they're not sharing it in a way that you can really understand what next steps are or what's the plan, I often we hear about what should I do if I feel dismissed or I'm feeling ignored. I tell my patients or anyone that I come across, tell that clinician and say, I don't understand what you're telling me right now. I don't understand, or I read this in my chart. Tell me why you wrote that. And I think that's another piece that we have to talk about when we say, know your body, know your health. Ask those questions. And if you feel those questions are being dismissed, then of course, finding someone else. So I think that's another piece in the playbook of advocacy that we have to also highlight.
And getting back to your chart. So, um, I had surgery recently, and I
Yes.
really had not announced that publicly to anyone, except for my close friends. But before the surgery, um, they did an EKG, and I don't know if I told you this, Doc. And they said that I had previously had a heart attack that I wasn't aware of, and I'm like, I didn't feel anything. I didn't know anything about it. So they sent me for further testing, and the doctor determined that that wasn't the case. I don't know what could cause a reading like that, but that's like very scary. That's why you need to know what they're saying about you. And then, of course, I did have one of my other friends who's a doctor. I said, what in the heck is this? What does this mean? And what should I be doing now? I don't smoke, what's going on? You have to be aware of what they're putting in your chart.
Yes.
I've even had um, the doctor have someone's transcribing. I don't know if this is something new, transcribing what is going on while they're talking to you.
Hmm.
And in the transcription, I go and read it, and he put something in there that wasn't true. And I told him, I said, no, 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 you take that out, because we did not discuss that. Probably out of habit, he just automatically put discuss this, this, and this. No, we didn't. So you really need to be very, very diligent in knowing what's going in your medical charts, right?
Yes, you should know, and there's often this kind of creature of habit, to your point, Dr. King, where they might just put something in there based on a template. And so looking at what was stated in your chart after is so important, because that is your health history. Imagine, I think this is a good example. Imagine if you ended up going to the ER and unfortunately you were incapacitated or not able to share information. That chart is what will speak for you. And you want to make sure it's accurate. And so I think when you kind of put that as an example, it kind of puts more force or depth behind making sure that that is representative of what your history is about. I think that's huge.
And in Bianca's case, in case of a lawsuit, if it's in that chart, that's what it is, right? If you have to go to take legal action, and they say that's what it is, you don't have a leg to stand on if you didn't correct it, right?
Correct. And so I think there's 2 points of, when we talk about what is memorialized in your chart and making sure that's correct. And then in that moment as well, advocating for yourself. And, Dr. King, one thing that is an important piece that I'm advocating for is when we talk about maternal mortality, which I know you had that conversation. And so I'll just share with people who are listening. I've had multiple things in my life that have ended up being very representative of my advocacy work and health equity. Well, when we talk about Black women dying at the highest rate and advocating for yourself, during my second delivery, I almost passed away. And I apologize because I always get emotional when I talk about this, but it's important to highlight that when we talk about access and social economic, there's so many different areas and reasons why this is happening. And so came out of the OR, had just delivered my second daughter. I knew I didn't feel right. I knew something was off and I was having a hard time speaking. I just wasn't myself. And I shared that with my nurse and she said, Bayo, you're fine. You look fine. This is normal. And so I let I don't even know how many minutes go by. And then I called her back and I said, something's wrong. And she said, what you are experiencing and what you look like is normal. And so I had my husband call my OB, I had his number in my phone, and I understand not everybody has that privilege. And he said, come back because something's wrong with Bayo. Long story short, he came back. He knew something was wrong and took me back to the operating room. And I was bleeding internally and I was transfused multiple units of blood and I was hospitalized for 2 weeks. And I share that story because my hope is when we talk about health inequities and disparities, that we push into the conversation that it's beyond access, it's beyond social economics, because I had the best access in the world as a physician, and this still happened to me. And so I share that because, to your point, whether it's in your chart, whether it's in the moment, advocacy is key to saving your life, your family member's life, and so forth.
Yeah, I'm sorry that I know that's very emotional. And Bianca shared her story yesterday, very similar. But so she also shared about Serena Williams, which I know that you know the story. And Serena had her Caucasian husband. They didn't even take her serious until her Caucasian husband came in, and that is absurd. And she's a celebrity. You're a doctor. Bianca's an attorney. I mean, it doesn't matter. It really
Correct.
doesn't matter. That's what I'm saying. We have got to stand up for what we know is right. Don't let the doctors tell you how you're supposed to be feeling or what's going on, because you're the only one that knows how you feel. And you have to be very vocal and honest about it, right?
So true. And that was my point by deciding to highlight this story. And that's what I did in my TEDx talk titled Do No Harm, was I needed to advocate for what is happening because we have so many different narratives of it's access, it's this. And I said, it's more than it's that's a part of the problem, but there's many different layers to this. And that's when I bring into the conversation unconscious bias, where if you can't see my pain or you don't feel like what I'm expressing or showcasing looks like pain, how are you going to respond to it? And that's where we need to think about this in a new way of all the areas that are impacting these statistics that we see. And so, yeah, that's why I wrote it. And I'm just hopeful that it can help as many people as it possibly can. So, yes, we just
Well,
have to continue to push.
the good news is that we have over 3 million followers on
Oh,
Facebook.
thanks. Well, please
200,000
take a look at it and share it
on,
with anyone that you love.
yes. And that's what we try to bring people in that can really help your life. We say that we empower spiritually, personally, and professionally. We
Yes.
do all three. This is she wrote a long one, but I wanted to just see if I could read it. Priscilla says, I know the importance of self breast examination, also mammograms. I found a peanut sized knot in 2014. I had a biopsy done and found that I had stage 1 invasive
Mhm.
ductal. What is that? What's that word,
Invasive
Mary?
ductal carcinoma.
Okay, thank you. Breast cancer that had not spread it, and it was contained in the mass. If I had not done my yearly mammogram and self breast exam, wouldn't be here. I wouldn't be a survivor. Found in May, cancer free. In November 2014, only needed radiation therapy. Thank you so much, Priscilla, for
Yes.
sharing that. One thing I am, well, first of all, everyone knows I'm a Christian. Everyone knows BW is a Christian organization. And so, being that my grandfather was a pastor for 70 years, one thing I do know is that we overcome by the testimonies of others. So when you share your testimony, you're in fact helping somebody else. So I thank you, all you queens, and I'm trying to get as many on the screen that I can, so that that's a people know that they're not alone. You're not in this alone. There's other people that have gone through it, have survived, and are surviving, and they're sharing how they did it.
Those shared stories are just so important because when you hear about it, then it provides that imagery of someone who has been able to get through it, or maybe will spark a thought, you know what, I should get a mammogram. Maybe I should find out my risk factors because, 80 to 85% of breast cancers, there's no family history. And when we talk about symptoms, we do have cases where people have stated that they had no symptoms at all. And so I think that part is important to the, equation. But, dimpling, retraction in the skin, color change is also an important piece. And we can't forget about also looking at the armpit and the breast area. So I think those pieces are also important when we think about looking for signs and symptoms.
I don't know that I heard too many people talk about it, but it used to be where they said if you didn't have kids, you had a higher rate of possibility of having breast cancer, or if you had kids before 29 or something. Is that still a fact?
So it all leans into estrogen. So we know that the longer period of time that you've been exposed to estrogen, that can increase your risk of developing breast cancer disease. So that kind of helps you kind of think about it with pregnancy. If there's been an interruption in that, or not interruption, but a change in that amount, and so that's where that statistic lies. So it's estrogen. The longer you are exposed, that there's an increased risk of cancer in that space. But again, so many different factors can increase your risk. Another thing that I think we often don't talk about is when we look at our environment, the food we eat, the changes that are present in our food to this day, and the possibility of that also increasing our risk. Because the foods that we eat today, some didn't even exist back then. And so that's another piece that I always like to also highlight because I think nutrition is a huge part as well.
What about getting your menstrual cycle at an early age? What is that?
Yes, that part as well. Because again, that estrogen exposure piece is another piece. So menstrual period, the age that you started your period, age, breastfeeding is another big factor as well. Did you breastfeed? Did you not? All of those parts are added risk factors or least risk factors that you have to take into your overall health.
Wow. Okay. Well, so wow. So now what advice can you give like the young women who are coming up to the age where they're going to need mammograms?
So, my first advice would be to take away the language, Dr. King, of what age they should get it, because now we're seeing women diagnosed at such an earlier
In their
stage.
20s?
Say that. Oh, so sorry.
In,
I missed that.
in their 20s?
We are. And
Wow.
so that's the part that we have to kind of reshape our narrative of what age you should get it. So that's where I think it's a conversation first and foremost with yourself and thinking about what is important to you as far as what you would like to know for your health. And then, of course, having a conversation with a clinician and then mapping out what time you feel you should get it, because right now there's so many different guidelines out there. Some are saying 40, some are saying 30, some are saying, all of these different factors. And so I think we have to kind of take note in, if you are in your 20s and 30s and you would like to get a mammogram, and maybe this may be unpopular for me to say, you know, I I think there's power in getting it done. Now, not every clinician believes the same way I do, but I think when we look at the rate of disease in African American women, that risk factor means something. And I think we need to honor it and also be able to respond to it.
Let me ask you something. does breast what do we like a reduction or to make your breast bigger, does that have any effect on breast cancer?
It doesn't. So when we look at like fibrous or dense tissue, breast tissue, sometimes that can be in smaller breasts and also larger breasts, but it doesn't necessarily have a increased risk of factor the size of your breast for breast cancer.
Oh, okay, so what I'm saying is, if you're having surgery, those surgeries like to enlarge your breast or to have them reduced, that couldn't be a factor on breast cancer at all.
Not as far as increasing your rate of getting the disease. No, that wouldn't. Now, if we're doing like diagnostic and imaging and trying to see, is there a cancer present? Sometimes larger breasts, dense tissue can make it difficult to see, and so I think that part is the conversation when we talk about being able to diagnose or risk factors to know the results. But getting a breast augmentation, whether it's to enlarge or a reduction, that would not change your overall risk of developing breast cancer.
So I remember hearing that someone, when they put some of those, I don't know what they put in there when they make your breast bigger, but some of them were leaking and causing problems, and that's, you're still saying that that's not.
So that can cause a cancer. So that's important to mention if we're talking about specifically breast cancer, estrogen related, and so forth. That part is what I was stating. But if it's because of a foreign object and getting cancer because of a toxin or the breast capsule or the actual implant is the best word, that is a whole different conversation outside of just traditional breast cancer.
But it's possible.
Yes, but different types. So I want to be very careful in in what I mentioned, because you have to think about the manufacturer, like who created that implant and those pieces as far as what would be leaking or those toxins and that concern of breast cancer, if that makes sense.
Okay. Justina says, and she has gone back on what you were saying about being treated differently. She said she experienced racist behavior from medical staff. It was so obvious, while her Caucasian peers were treated humanely by nurses. She was treated like an animal. That's pretty rough.
Oh, first and foremost, Justina, thank you for just sharing that. And there's so many different stories of people being dismissed. And I'm going to throw out a couple of diseases that I think don't get the attention that they deserve in respect to the amount of dismissal that continues to happen. So we talked about maternal mortality, breast cancer, all of these kind of high rates of disease. Well, let's also talk about sickle cell, how the population, we often hear that it primarily affects Africans or Mediterraneans. And when a person with sickle cell is going through a crisis, meaning the blood has turned into a different shape, truly, and causing a blockage is the best way to explain. So when you have a blockage in a vessel, you don't have there isn't the ability for oxygen to kind of go through. And so that can be quite painful. And that's why we call it a sickle cell crisis. And you hear the stories of people, of individuals going through a sickle cell crisis. And then there's this association or labeling of they must be a drug seeker, or I'm just going to dismiss their pain. They don't really need pain medication. And so I bring this up because just with the story that she shared and how being of a specific color, and then you add intersectionalities to whether gender, ethnicity, and then also the color of your skin and a disease, all of those areas contribute to the disparities that we are seeing in so many different diseases.
Yeah, so Julia, and I can't, she says she's Native American. This is interesting because it seems like she almost wants to fight, but we know that any woman could it doesn't, I mean, the highest rate is statistically proven that Black and brown women are treated differently. And you're a Native American, so you would fall into that brown woman. So we're not saying that it's just all Black women. So she says, no, thank you. I'm a Native American, and it is not all about African Americans. Sorry to say that. Um, understand what you all went through, but please stop it. Natives went through more worse, but we're not crying about it. Stop making it all about you all. I had to laugh at that. I'm sorry. We're not making it all about us. We've always said Black and brown women and women of color have been treated differently. And as a Native American, you fall into that category. So don't think that we're saying that it's all Black women. But thank you for your comment. So Dr. BCW, where do we go from here?
So, the important piece is to really lean into advocacy, being informed, and thinking about what you can do to have the best care that you deserve to have no matter what. And so I think where we go from here is educating ourselves, being informed of different signs, symptoms of diseases, knowing the rate of diseases. And then, when you are being seen, if you feel you're not being heard or taken seriously with any of your concerns, I often say, and I know I already said this, but I'm going to repeat it, share that with that clinician, because I think sometimes it may be unconscious bias and sometimes it may not be of malice or ill intent. And if you are still dismissed, making sure you advocate and get to someone who will take your concerns seriously. And I'm just grateful for this conversation. Thank you, Dr. King. And I do want to share with everyone, I have a free health series that's available on a wide variety of topics that helps not only provide awareness and but also leans into solutions. And so please check it out. It's Dr. underscore BCW on Instagram, TikTok. I've
She's
got the series.
everywhere.
Say
She's
that again.
everywhere. But I said she's
Oh,
everywhere. We're gonna post it in the comments. We're open for questions. Someone just said, and I'll put it on the screen. What should I do if both the mammogram and diagnostic are negative, but I feel nodules?
so I would recommend getting talking, of course, to your clinician, but it's possible to go back either every month, every 3 months. Of course, that serial testing can be different. I would say continue to get screened, continue to monitor it and watch it. Now, that being said, depending upon your clinician and the discussion and health history, they may decide to do a biopsy as well. And so that may be an option for you. I'm very careful with, providing direct information, but those are some things that you could at least introduce to the conversation to see if you can get to know more.
Yeah, and I had that happen as well. And so I had I don't know what the next level was, I forget, but I had to get another type of mammogram. What is the next level up,
So you
Doc?
have the diagnostic, they have 3D, they have all different
I think I
types
did the
now. Yeah.
3D. Well, I actually I always get the 3D. They did something else, but it came out negative because I have very dense breasts too,
Hmm.
and I felt it myself, and everything came back negative. I'm 66 years old. I've been getting them since forever, and I don't miss, because sometimes that one time you miss, that's when it pops up, and I've heard those stories many times, right, Dr. BC?
I've had, friends, family members, patients who decided to wait not only a year, but sometimes just wait a couple of months. And based on the stage or the type of breast cancer, that can make a difference with life and death or complications. And so that part is important. I say, set it on your calendar to make sure that you get it done. And again, it doesn't have to be October for us to talk about this or advocate for breast health. Make it a habit to check, just like we do things in our everyday life. I often share with my patients, make it an everyday part of your life to invest in your health in any way that you can, whether it's breast health or nutrition or just knowing, what is happening within your body is so vital.
It is very, very much so. So while we have Doc on here, if you have any questions, you need to type it in the comment. Doc, let me type in what's your website or whatever you want me to type
So
in
I have a
here.
website. It's drbcw.com is my website. And then social media, it's dr underscore
Honey, I
BCW.
can't type that fast.
Oh, yeah.
You're on a roll, drbcw.com. I
I
got,
always talk fast.
yeah, girl, you be like,
I get excited. And when it's something that is just near and dear with,
I
this conversation,
understand. I
helping
understand.
people.
All right. So what's the next one?
So the social media is dr underscore BCW. And you can find me on Instagram with that, TikTok as well. And then I have YouTube as well.
Wait a minute. DRBC, DR underscore, what is it?
BCW, my initials.
Okay.
And
And
that's for Instagram and TikTok. And then on YouTube, it's titled Beyond Clinical Walls, the whole for YouTube. But TikTok and Instagram are my biggest reach. So, and LinkedIn, you can find me on LinkedIn too. I don't want to discount LinkedIn, which is lovely. And that's under just the Dr. Bayo Curry, or not doctor, excuse me, Bayo Curry-Winchell. You can find me on LinkedIn.
okay. Okay. I think I got it. Oops. It keeps doing spell check and putting the wrong thing in there. Hate that.
That happens with my name too. Like they think I'm spelling my name wrong. I'm like, no, it's Bayo.
All right. So, everyone, I thank you so much for your comments. I thank you for sharing. Please share, 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 because that's the only way we're going to spread the word by you sharing this on Instagram. You can go to the YouTube channel if you don't know how to share off of we're not on Instagram, but if you don't know how to share off of LinkedIn, you're not on LinkedIn, you're not on Facebook, you can always go to our YouTube channel, WBWE Live, and you can get that link and share it. And Queen, thank you so much, Queen. Who was it that said that? Okay, Raquel, thank you, darling. Thank you, Sherry. Everyone that you guys are so amazing. We really thank you for your input,
Thank
all your comments.
you.
And we'll be back tomorrow. We'll be on LinkedIn Live and we'll be doing Christian Women Level Up. You do not want to miss that. I'm going to be talking about how to build your social media following and I can't remember her name now. I'm drawing a blank. But my counterpart is going to be talking about government contracts and how to start your business and grow your business. Don't want to miss it. It'll be 11 o'clock tomorrow on LinkedIn only. We're only going to be going live on LinkedIn tomorrow. So please join us tomorrow if you can at 11 o'clock on LinkedIn and get some tips. And we're gonna keep it going because we want all women. We want to share with all women, but we want the Christian women to level up. We want you to be all that you can be, all that you're called to be, because your life has purpose. And if you're not walking in your purpose, you're missing everything. I love you all. As I always say, I love you. There's nothing you can do about it. You can check out our website, bwbusinessnetwork.com. That's our partnership with Dr. Matthew Knowles and Kathleen Triggs and Reese Sood. You can go over there and also go to blackwomenempowered.org, which is our website. We have inspirational posts every single day of the week. God bless you. I love you. Till the next time. Take care.
Thank you.